Because the iliac arteries are common site for atherosclerosis, an arteriofemoral bypass can be done to bypass the iliac arteries to restore circulation. The graft will be implanted between the aorta and the femoral arteries. An axillofemoral bypass creates circulation between the femoral arteries and the axillary artery. This restores circulation to the lower extremities or an emergency procedure to bypass an infected aortic graft or aneurysm. A femoral bypass, FemFem, involves the implantation of a prosthetic graft that connects the femoral artery on the affected side to the opposite femoral artery. This is done to bypass a unilateral atherosclerotic disease of the iliac artery. A femoral popliteal bypass is better known as a FemPop, and the goal is the restoration of blood flow to the leg by bypassing the occlusion. The bypass is done by grafting with a synthetic graft or with an autograft of the saphenous vein. The greater saphenous vein is the longest in the body and is also used for coronary bypass grafting. If the popliteal artery is diseased, the surgeon may bypass to a more distal part of the popliteal or down lower to the tibial artery, thus making this procedure a femoral tibial bypass, a FemTib. Another method is a FemPop in situ. In this procedure, the saphenous vein is not removed, however, the valves will be removed with a valvulotome. A varicose vein is an abnormally dilated, tortuous vein that is produced by prolonged pressure within the vein. Incompetent valves cause the thin-walled veins to bulge, causing pain, swelling, and venous stasis. They can be surgically incised, ligated, or stripped as a form of treatment. They are removed to prevent symptoms and improve cosmetic appearance. Amputation was discussed in more detail in the orthopedic chapter. The surgeon ligates the popliteal artery and vein and grafts the sciatic nerve with a coker or other heavy clamp. The end of the nerves are crushed to prevent the formation of a neuroma.